Hi, this is Dr. Toby Moma, your host on Health and Wellness with Dr. Toby, inviting you to watch our show this week. We have a special guest, Miss Felicia Downs. She's a local of the area, trained, raised in Bastrop. She's going to share her heart with us about the community. She's a licensed community social worker, went to ULM and went on to Southern University in New Orleans, and she's going to be pouring out her heart about her pet project. She just opened an agency called Resilience, and is designed to mitigate the after effects of perinatal morbidity mortality on our young children under 1 year of age. You don't want to miss it. She's going to pour out her heart about family, about the church, about spirituality, and how being a social worker has inspired her to make a difference. This is a lady who's lived a life as a daughter, as a sister, and as a minister in the church, and she wants to be a blessing to you through this medium. So don't miss it. Check it out. God bless you. Jesus is Lord. Hi, this is Dr. Toby Moma, your host on Health and Wellness. It's a pleasure to have you on our show. Don't touch that dial. We have a special guest with us, Miss Felicia Downs, licensed clinical social worker, founder of Resilience Agency, designed to help boost families back up and attack the epidemic of perinatal and infant morbidity we see in our young children. Children who are given birth to by women who have conditions that affect that child long term. And that's what her focus right now is. And her passion, she says she found her niche, she found her passion, and she wants to make a difference. And the great thing is that she's doing this locally in our community. Welcome on the show.
Thank you.
Ms. Felicia, a real pleasure to have you on our show. So we've been talking about social work, and she gave us a great background, how you could be a social worker, where you could go and attend if you want to become a social worker, what pursuits, where the licensure exams, and she told us she could do it, and if she could do it, anybody could do it if you have that drive and passion. So I want to talk to my high school students who are looking for a career. It's a 4-year program. A master's is a 1-year program. You can do this. Don't think of quitting because it's too long or it's too expensive. You can do it, and you will make a difference. The benefits, trust me, if you can change a life, it's worth it. So we're going to continue our talk today on our community in Northeast Louisiana. We're talking about the conundrum we see of dysfunctional families. Give me an idea of child neglect and child abuse in this part of the country. A lot of us watch CIS or whatever those movies are, and it always tells you it's in New York, Chicago.
Right.
So people may not even think we have those issues here.
Right.
So can you give us an idea? Are there statistics that tell us what the prevalence are in our community?
Yeah. In the state of Louisiana, our latest statistics from the Annie Casey Foundation shows that in 2017 that there were over 8,000 reported cases of child neglect, over 1,600 cases of physical abuse, and over 500 cases of sexual abuse. Those are just the cases that were reported. So there's a lot of cases that, we have a lot of families that we don't, and a lot of people still, what happens in this house we don't talk about. And so those are just the cases that we know of.
So give me an idea, what is the penalty for child abuse, child neglect, sex abuse in the state of Louisiana? Because I know every state is different.
Every state is different, and in the state of Louisiana, there are certain criteria by law that DCFS and child welfare workers have to adhere to what meets the criteria for removal, because all of that has to still go before a judge. And the judge ultimately makes the decision whether that child will be removed or whether that child, if the child is removed, if that child should be returned home. One of the things a lot of people always think about, well, they should do more, they should do more. Sometimes it's not in the workers' hands on what they can do, because each by law they have to follow the law. A parent has to work their case plan and have the ability to get their children back. And so even when there's severe cases, the parent still has to meet and be tried before court, as in a criminal court. Not just because we might have validated your case in child welfare, but then it goes to criminal court, and that's just as in any other crime that's being committed, that you have to be proven guilty.
Give my audience an idea what you mean by severe, mild, moderate child abuse, child neglect, sex abuse. Just give us an idea. I mean, you don't have to be so vivid, but at least a clue. I mean, because there are people listening who know cases, who have witnessed cases, and they're like, I didn't know where to go to. I mean, can you give them an idea? What is reportable? What is just pushing on the table?
A spanking that leaves a bruise or a mark, or a harsh discipline, removal of food, even emotional abuse. A lot of children experience emotional abuse where you're withholding love and a compassion for a child. Leaving a child alone for long periods of time can be neglectful. It just depends on every situation. They look at things differently in the context, so they do it on a case-by-case basis. And for us, what the law would say that this warrants that us petitioning the judge for a removal. And even if they don't do a removal, then they have family services, and where they're trying to keep as many families together so that they can make sure that that child grows up in a loving environment. When they implement family services, they're going to give the parent and the child counseling to talk about whatever services are preventing you from being the best parent to this child. We want to implement them in the home so that you can remain in contact with child and raise your own children.
Give me an idea the role social workers play in the context of the medical complex. So when you finish social work, what are the diverse avenues you can maximize your training? In what areas? You told us the NFL, prison. So give us just a clue. Okay. If somebody wants to take a career path in social work, what career paths are available?
There are some social workers who are working for law practices that they do family mediation when there are divorces they're going through. There are some social workers who work in hospital, long-term care centers, Alzheimer's units. They work with, of course, child abuse and neglect cases, mental health, gerontology, any type of pretty much schools. A lot of times we don't think about social workers being in schools. All schools systems have a social worker in place. There are just different avenues. Some businesses are now having social workers on staff so that they can mitigate whenever there's problems to make sure they have their work balance relationship.
And then academics.
Of course, in academics.
You can
yes,
do a
professors
doctorate or become a lecturer.
Correct. And then there's also social workers who focus on research. One of the most well-known social workers is Brene Brown, who is in Houston, Texas. And she has written several books, and she classifies herself as a researcher.
Actually, there's a famous social worker in USM, University of Southern Mississippi, and he's done phenomenal research on childhood obesity because we have an epidemic of that in Mississippi. Now, the opposite of that is hunger. There are people who will never believe that there are hungry children in Mississippi or Louisiana. Is it true that there are children who go to bed hungry in the state of Louisiana in 2019? From your experience as a social worker?
Yes.
I mean, where are these kids? I mean, don't we have enough food banks and all those, I don't want to say shelters, but resources?
Right. And it's a misappropriation of some of the services that are afforded to some families. Unfortunately, that's what it is. Or if they are going to bed hungry, then there's not nutritious meals being provided. It may not be, they're left to maybe, for different factors. They may be left to have, sort of fend for themselves. Well, children for dinner may eat a bowl of cereal, or they may do, noodles, or so they may be hungry because they haven't had a nutritious, well balanced meal. And then we also think about that there's a misuse of the programs that we do have in place. Unfortunately, that is true. Not that that's true for every family who receives any type of subsidy or anything like that, but there are families who misuse those, and I've met families who've utilized certain subsidies because they needed to pay rent, and so they've, bargained and negotiated to get additional funds to say, hey, I need to pay my rent. So it's different factors for each family, and each situation is different.
So if I'm a teacher in a high school or at elementary school, and I notice this kid is always eating, hungry, looks like she's losing weight, unkempt, the clothes don't look well taken care of, doesn't take a bath, looks haggard. I mean, who do I talk to? Obviously, I can talk to the child, but if he's a teenager, is there any resource out there in the state of Louisiana that I can use to reach out to that family?
I think you can call your local child welfare agency and just ask and say, I'm concerned about this person, this child that's in my school. But you also have that conversation with the school counselor. That school counselor should be a great resource, or your pupil appraisal department, who keeps in contact with child welfare and make sure that they understand exactly what's going on with that family. And some of them, it could be that the family is displaced, or there's a major illness. I've worked with families, the children presented like that in school and found out mom was in the hospital. She, was having a major procedure done. And so the caregiver just was not concerned. And so once we brought it to their attention, things were done differently. Mom found out and changed caregivers.
So with all the WIC and with all the food stamps, people still are living in very severe poverty in America. So in your nutshell opinion, especially looking at the perinatal population, because every pregnant woman in America gets food stamps, WIC, and I think insurance, right? Except they are very wealthy.
Right.
So you're looking at perinatal infant morbidity. What do you think is responsible for that neglect or that lack of care on the child? If the mother is getting all this required food stamps and I mean, what is making that child being born in a dysfunctional environment in spite of all the government support her parents are getting? What more can we do as a society to stem perinatal and infant morbidities? For example, a child is born to a mother who was impaired nutritionally. Maybe she was on drugs, maybe she was not eating well. And as a doctor, I know that will lead to, there's a lot of things we call it, but there's marasmus, there's kwashiorkor, there's malnutrition, and all that can lead to loss of academic potential in the future for that child. So talking about the perinatal, what can we do to help stem that attrition on our children because their parents are malnourished or their parents are living a dysfunctional life? How can we as a community, as a society, help in this research, in this program that you're leading right now?
I think one, it starts with conversation. I've worked with a lot of individuals who talk about, even though I have access to these resources, me attempting to access them, it's been very difficult. A lot of families don't want to go to certain agencies, and because of how they're treated and how that they're not listened to, or how they're passed judgment on. And so a lot of times they're missing appointments, even though we have, I talk some of the WIC staff, and one of the things that they have to do is families have to call in and get their next appointment. It's not automatically, given to you now. That's a new rule. And so we talk about those things and like, what is the barrier for you making sure you get that WIC appointment. And some of it is I don't have transportation to get here. I don't have, they're rude when I come, so I just rather just do without. And even though they don't understand well the impact that this is having on the child, that they feel like I'm just trying to use the system, but I'm trying to do the best that I can. But I think if we just learned a different way, our approach in customer service and how we are attentive to the people who do come to us for help, then I think we'll see better results and educate them on the importance of it. Because sometimes we can just easily say, hey, take this, and they don't really understand what you're telling them. I've worked with so many different families who had no clue, even with me working with psychiatrists. And, they are prescribed medication. And then we talk about it, and they was like, oh, I really didn't understand what they were talking about. I just agree with them. So how much is it that the people that we're in charge of helping really don't understand the impact of not following through, or the consequences if we don't do if they don't follow through with the recommendations. And I think that starts with us having empathy and understanding where that person comes, and be open to understand the challenges that it may have taken for that person to get to that appointment. Not everyone has transportation. Transportation is a huge barrier, especially if you're in the rural parts of our region. That it takes a lot to get a ride, and so to be a little bit more open and understanding, I think will go a long way. And people will be willing to have that conversation with you to tell you what's going on and what's impacting them from them not being able to follow through on your recommendations.
So normally Mississippi always takes the last position when it comes to health indices. But this year Louisiana got the last position. I don't know if you saw the data. I don't know how they come across it, but I think it's basically access to care, poverty levels among patients. So it tells me that something is going on in the state of Louisiana. I know they expanded Medicaid.
Correct.
500,000 people were maybe brought in with less. They didn't have enough providers, obviously.
Right.
So I'm just trying to ask, in the state of Louisiana, is poverty the number one cause of illness, or is it ignorance? Because when you look at the data, HIV is really high in Louisiana. Gonorrhea, chlamydia. Is it poverty? Is it drugs? Is it just plain ignorance? They don't know better, so they don't do better. So as a social worker, I don't know if you've seen any statistics or done any research in that regard. Talking about the state of Louisiana, what do you think is responsible for this health indices that puts Louisiana at the bottom? Do you think it's just poverty? Do you think it's lack of education? Do you think it's something else?
I think it's some of all. I don't think it's just one thing that we can isolate and say this is it. I think all has, and for each family, each person is different. For some, it is poverty, that they don't receive, or they don't have access to the care. And when I say access to the care, yes, Louisiana did expand with Medicaid expansion, so we have those. But then I can have Medicare, I can have Medicaid rather, but that doesn't mean there's a provider in my area who's accepting my insurance. And that's one of the things that I was talking to someone recently about, that Medicaid providers are paid the least amount of money. So you have a high volume of patients per that provider. So you're thinking about, is that provider actually spending a lot of time? Do they have the amount of time to really educate their client on their illness, on what they need to do to follow up on these things? And so I think that we have to also look at what role that when we have these determinants, how are they impacting us as a community? Because we have the laws, we have these things in place. But let's have a conversation with the people who they are most affected. Because I can have Medicaid and say, hey, I can go to this provider over here, but there's also, they're going to spend 5 minutes with me when I go into the examination room, because they have 30 other people waiting for them. So they just don't have the time. So I think we have to also look at, even though we are saying we have given you these services, what is the quality of
Quality
those
of the
services?
services.
And I
Right.
think if we start really looking at the quality of the services, then we'll start seeing some of those numbers decrease.
Health disparities is a big deal now.
Yes.
I just came back from a conference and they were talking about the African American female has a 3 times higher risk of mortality in
Yes.
pregnancy compared to the average population in the United States.
Right.
I mean, that's shocking. I think it's 2.9 or 3. And then even in cancer, the average African American has twice the risk of the Caucasian to develop colon cancer, and I think 3 or 5 times higher risk to be on dialysis. And so what I'm trying to say here is this: what is the cause of the health disparity we see in 2019 in modern day America? Everybody has, at least you can, I mean, I'm not saying everybody has access, great access, but it looks like these women deliver in the same hospital as the Caucasians, Native Americans, Hispanics. So why are they higher risk of dying on the table from the same delivery another Caucasian, Native American, Hispanic just successfully went through? What is going on in this African American community that maybe we need to pay attention to, that might be something in the background that is causing this increased health disparity that we're seeing? Is there something that we in the medical field are not aware of, maybe in the African American community, that is affecting their health indices so greatly?
Right. I think one thing for sure is that we have to be aware of the stressors that being Black and American brings, and what does that mean to a parent. With me working with pregnant women, we talk a lot about what this is like, because your body and the traumatic experiences that they have, and what it's like being Black in the community where they reside, where there's violence, where there's racism still exists, and they talk about how that they are in fear. So even if I'm carrying this baby, my body is responding to that anxiety and the stress that I have, because I'm going to produce a child with low birth rate, or I'm going to go to preterm labor. And all of those are factors that determine how that we are dying at such enormous rates, because no one is willing to address that there are some things that we as a community are contributing to, that we're talking about young women who are going in for prenatal visits, and when they're talking about pain that they're in, they're being dismissed. I worked recently with a mom who went to her physician 3 different times about pain, and they said, no, there's nothing wrong with you, go home. Well, it was only for her to go home, and she was in labor, and for her to return, and within 15 minutes she delivered. And so when they found out that while they immediately prepped her, they said, oh, you've lost most of your fluid. So she had been having this conversation. She went to the hospital 3 different times, but no one was willing to pay attention.
She was making just being a.
And that happens a lot in the Black community. That we're not, and not only with other races doing that too. Sometimes we as Black people do it to other Black people. We dismiss what they're saying as though they're not valid, or they don't know what they're talking about, or that we don't ask the right questions. And sometimes it's just a cultural saying certain words may mean something different in your culture than they do in mine. So we make sure we have to be understanding when someone comes to us for help, that we're actually listening to what they're saying, what their experience is, and not be dismissive of that experience.
So what we call it in medicine, you have to have cultural competence.
Right.
So if I go to a Hispanic lady and I see her moving her hands all over the place, I've got to understand that that's just the way they communicate, right?
Right.
And if I go to a Muslim lady and they're very private, they don't like men doing private things with them, that's part of their culture. They'll rather have a female.
Right.
So it's important, I think, in the medical community that we're culturally competent.
Right.
So that when we deal with individuals, we realize maybe there's a cultural thing
Right.
attached to this as well.
Right.
So that's an interesting
Right.
aspect of it.
And we've even gone on to say that, competence means there's an end to the education, where every person, every community is always evolving. So we just want you to take a stance of cultural humility, to be able to say, if I say that offends me or don't do that, then you're attentive to what I'm saying. That it's like, well, it doesn't matter if the last black woman that you saw, it didn't offend her, but it offends me. And I
Right.
think even in my profession, I think about that. And when I'm with peers, sometimes I feel like my voice is not being heard. With as much education as I bring to the table, I still sometimes will sit in meetings and think like, am I being dismissed? Or you're not listening to what I'm saying? And then I see you'll come back and say, oh, you did say that, huh? So, and I think that's sometimes we do that even with our patients and clients that we see, that we're not listening to them, or we feel like, oh, they're just saying something, they're just making excuses. And they're not saying that some people, we haven't had that experience, that people are just not wanting to do what it takes. But we also have to approach each person with the openness and to be able to say that this is a different individual. I'm not going to let my biases, predict how I treat this person.
Right. I had a patient I sent to an orthopedic in the area, and I mean this lady's in her 60s, and she came back to me so upset. And I said, "What was the reason you're so upset?" She said, "Can you imagine? He called me a big girl. Said, you're a big girl," and she took it so
Yes.
So I guess there are bases for people to interpret those words.
Right.
Just like when a man calls a African American male a boy.
Right.
So
Yes.
people can take that and obviously can build a
Right.
wall that the person stops listening to everything else you're
Yes.
saying.
Yes.
So communication makes a big
It
difference,
does.
definitely.
It does.
And nobody wants to go where they're not respected, where they're not
Exactly.
heard, and where they're not valued. So
Correct.
I think we need to open our doors and give each other hearing so that we can improve the health disparities, because it's a big, big issue.
Yes.
You know.
Yes. And I
It,
think that starts with having conversations where, when we're making laws, let's have a conversation. Because sometimes I think we as professionals, we know what's best for you. We want to be talked to as though we're the expert. We know what you need. And it really may not be what they need. But I think if we would be open to have those conversations with the people who is going to affect the most. I live in a different area. There are certain developments in Monroe that I don't have to live in. My income is such that I don't. So I can't say what's best for them or what they need in that particular area. So it doesn't help if we're talking about bringing about change that I have a conversation with the people who reside there. And that's so important, that sometimes we get lost in the mix, that we like to tell people what they need instead of having them be part of the conversations, and to know that their opinion matters and this is affecting them. And so they have a say so in it.
Now, Felicia is doing a lot of work as well on the opioid epidemic. When we come back, we're going to talk about this 2019 opioid epidemic in the state of Louisiana and how she's helping to combat that. You don't want to miss it. This is Toby Momo. Write to us, P.O. Box 550 71294, telling you Jesus is Lord. God bless you.